Hey guys, this is Dr. Samir Islam. I want to thank you for joining me today on my Facebook Live. And so tonight we are going to be discussing obesity as we've been doing for these past couple of weeks, but I'm going to focus on some of the endoscopic options now that we have for weight loss and obesity. I'm really excited to talk about this topic because this is something I feel very passionate about. I think this is really a big game changer in terms of how we deal with obesity and how we deal with the obesity epidemic. So talking about the prior lectures, before we talked about the problem of weight gain, what contributes to weight gain, why do we get fat, and what can be done about that? And in today, I'm going to focus on some of the endoscopic procedures for weight loss. I'm going to focus this week on Obalon, which is the first gas-filled balloon to help you with weight loss. So in these past couple of years, there's been a remarkable change in how we address obesity. The two different ways that you used to deal with it was either diet or exercise and surgery. And a lot of people did not either have effective results from diet or exercise or did not want something as dramatic as surgery. And so they're looking for a middle road to see if there's a better way or perhaps a less invasive way to help you lose the weight that you want to lose. And in the past couple of years, that road has opened up to the endoscopic options we have for weight loss. So the benefit about all the endoscopic balloons that we have and endoscopic sleeve gastroplexy is that typically it's non-invasive or at most minimally invasive, and it's non-surgical as well. And additionally, we are sparing the anatomy. What I mean by that is that with any of these procedures that we opt for endoscopic treatment of obesity, we're not changing anatomy in any way, we're not altering who you naturally are, and we're not making any particular change with that. Now, because these options are very new, unfortunately the vast majority of insurances are not covering that. But for those people who are interested in some of the non-surgical ways to help you lose the weight that you want to lose, these are a very effective alternative to help you lose that weight and to not have some of the more surgical type procedures for weight loss. So the first one I'm going to talk about today is Obalon. Obalon is the first and only gas-filled swallowable balloon for weight loss, and it's been approved since 2016. So basically, you swallow three pill-size balloons, and we inflate them in the stomach, and they're all filled with gas. So what makes Obalon different is a couple fold. So number one, it's non-surgical, and this is very similar to all the balloons. There's no type of anatomy. We're not changing your anatomy. We're not cutting you open. It's completely non-invasive. Number two is also it's very convenient. It really takes about 10 minutes to place. All you have to do is swallow that small little capsule. It'll go into the stomach. We check to make sure it's in the stomach. Then we inflate the balloon with gas. Number three, it's gas filled as well. This makes it very different. Some of the side effects that some of the other procedures have may not be as prominent as they are with Obalon. Number four, it is designed with comfort. We typically do one balloon first, then a couple weeks later we'll do the second balloon, and a few weeks after that we'll do the third balloon. And so people can gradually get used to feeling these balloons as they're being placed within the stomach. And number five is that it has been shown in clinical trials to actually have effective, sustained weight loss. It's very effective. And a lot of patients who are undergoing Obalon have had great success in losing the weight and maintaining that weight loss as well. And then lastly, it's safe, and that's the most important thing. We don't want to do something that's not going to be safe for you. And in the vast majority of patients who proceed with Obalon, have had excellent results with a good safety profile. So with each balloon placement, you lose more and more weight. In fact, you lose about 4.5 times more weight with the three gas-filled balloons than you may with some of the other procedures as well. And the weight loss with Obalon, when you compare that to just diet and exercise alone, you lose roughly 2 times more weight loss with respect to some of the more conservative options that we have. And excuse me. And up to 80 to 90% of our patients who undergo the Obalon option maintain that weight loss even after the balloon is removed. And that's critical because there's no point and for someone to have to go through a procedure and not lose the weight and maintain that weight loss even after the balloon is removed. And so it's very effective to allow you to get over that hump and to continue the weight loss even as the balloon is removed. Now there are some side effects like there are with anything we do. There is some mild cramping or abdominal pain or nausea, which typically resolves within the first 1 to 2 weeks. The benefit about Obalon is that because we're only placing one balloon at a time, these effects are very mild in nature, and typically most patients do really, really well in terms of not having significant side effects. And less than 1% actually had any serious side effects. And so over 99% of our patients who've undergone Obalon did fantastic and did not do any problems. And there's been no reports of pancreatitis or hyperinflation with the Obalon option. So the way it really works is a very easy procedure. Basically, you swallow a capsule about this big. You swallow it, it's attached to a microcatheter. Once it's in the stomach, we verify it's in the stomach with an imaging test. Once we verify it's in there, we inflate the balloon with air, and then that catheter is removed, and that's it. It literally takes about 10 or 15 minutes. There's no anesthesia involved, there's no downtime. You can pretty much go back to work that exact same day. It's a very easy procedure to do. And then we place additional more balloons for a total of 3 balloons over the first 3 months. And this gradual placement of the balloons helps to minimize some of the side effects that may occur. And then most importantly, like I mentioned with all my patients who undergo any type of balloon therapy, we do have you go through a full weight loss program to help you lose the weight that you want to lose. The most critical thing for weight loss is not necessarily the balloons, but it's the accountability that our patients get. We're seeing a nutritionist once a month for the full 6 months. It's that accountability that tells you exactly what to eat, how to eat, and actually provides a guide to make sure that you're able to do the things that you can do to help you lose the weight that you want to lose. And after the 6 months are done, we do have to go down with a small little camera to remove the balloons, very light sedation, but you also continue the program for 6 more months for a total of a year with the nutritionist program and with the diet and exercise. And it's a year program that helps our patients to hit that 89 percentile to maintain that weight loss even as the balloon is removed. And here's a small little video of the actual Obalon procedure. So basically you swallow the catheter, you swallow with the small little capsule, it goes into the stomach. We verify that it's in the stomach, and once we know it's in the stomach, we inflate the balloon with gas, we pull the catheter out, and subsequently you can eat. And whenever you eat, you do get fuller quicker than what you normally do, especially when you place in all 3 balloons. And this is what the goal of the balloons is to allow you to not eat as much as you had in the past. And so, like I mentioned before, it's very critical for our patients who go through any of the balloon therapies to make sure that they follow up with our nutrition and lifestyle coach. This has been instrumental in making sure that you're able to lose the weight that you want to lose, because like I tell anybody, we can place the balloons in there, you may lose weight, but it's that accountability that will allow you to not only lose the weight, but to maintain that weight loss. And that's been very critical in the success for anybody who wants to do any type of endoscopic balloon therapy. Now, there are some patients who this may not be the best option for them and it may not work. So if you have difficulty swallowing, or if you have any prior surgeries that will make swallowing that catheter more difficult, this may not be the best option for you as well. If you have to take any medications that can hurt your stomach, like aspirin, anti-inflammatory medications, any anticoagulants or blood thinners, or anything you take like that on a daily basis, this would not be the best option for you as well. If you've ever had any prior gastric surgery, so you've changed your anatomy in some way, either with a gastric sleeve or a lap band, and that's permanent, this would not be the right procedure for you as well. While you have the balloons in there for the 6 months, you have to take some sort of acid-reducing medication to help decrease the acid in the stomach. And if you're not able to take that for any number of different reasons, this may not be the best option for you. And also, too, based on your medical history, there may be other things that we're not talking about in which this may not be the best option for you as well. So the biggest question I get from all my patients is how much does Obalon cost? And the price can vary depending on where you're at and depend on exactly the location where you're at. I would encourage you to contact your healthcare provider to ask that. And I'll be putting up a link to our ebook, which talks about the cost for Obalon. But it is unfortunately not covered by insurance, and so it's a cash pay only. Is financing available? That's very common. In a lot of places there are. We do have local financing here available for our practice. And so for those patients who need that financial help, which I completely understand, we have financing available. And the big question you may ask yourself is it worth it? Now, this is a question it's an important thing to ask, because for some people it may not be worth it, and that's perfectly fine. But when you look at the downstream costs of obesity, and I tell this to a lot of my patients, obesity can hit you in a lot of different ways. So you can have obviously the obesity problem itself, which can lead to really bad diabetes. That will need more medications to help treat your diabetes. From diabetes complications, you can get kidney disease, so you may have to go on dialysis or end-stage kidney disease. You can have eye problems, so you have to see an ophthalmologist for your eye problems. You can develop problems with nerves in your feet, so you can have really bad neuropathy, which can cause significant medical problems as well. With obesity, you can also get higher risk of developing hypertension, which can lead to more medications, which can also lead to complications from that and more doctor's visits. With obesity, you can also have cardiac heart failure and have problems with your heart. So you may need a stent. You may need to have an angiogram. Also with obesity, you can have arthritis pains. You may have to get a new knee, a new hip, new joints. And so these are the downstream costs for obesity, and people don't realize that at that time because they may not have that right now. But when you think of the whole cost and the long-term costs of obesity, and that just includes just the medical problems. That does not include the emotional problems that can occur. That does not include the possibility of you not being able to play with your kids or hang out with your kids or even live a long life. Those are the significant costs that can happen with long-term obesity if it's not treated. And within your mind, you have to say, hey, is this worth it for me? Is it worth it for me to have this weight? And that's only a question that you can answer. And it's a hard question to come to a good answer to. But for those patients who've been successful for our programs, I can almost tell you they felt like it's been worth it because of the weight that they lost. So what are the next steps? If you are interested in Obalon, and I would encourage you to make an appointment. We see visits outside of our area. We do phone consults. We do anything to talk about what we can do to help out with your weight loss. Make an appointment. Either visit my website, SamirIslam.com, or my weight loss website, DrIslamWeightLoss.com. And there I have a lot of videos and links about different types of procedures we can do to help you lose weight, including Obalon. Or you can call our office as well, and we're more than happy to accommodate in any way. So in summary, Obalon is the first and only gas swallowable fill balloon. It's non-invasive. We're not changing your anatomy. We're not changing anything about the way your stomach or your GI tract is. There's very minimal, if any, downtime, and our patients are having very effective weight loss with this particular procedure. So in summary, we talked about some of the options for endoscopic procedures for weight loss. Next week, we'll be talking about Reshape, which is a dual balloon that we have for weight loss. So I would encourage you to join me next week for that particular Facebook Live. If you're interested in learning more about weight loss, some of the things that we can offer, some of the non-surgical procedures for weight loss, I would encourage you to download my free ebook. I'll put the link to this at the very end of this Facebook Live. In here, I talk about all the other options that we have, the pricing, the financing, and some of the things you can do to help out with your weight loss.